Welcome to the Leader to Leader podcast. I'm your host, Susan Spears. Our guest today is Christopher Lindsay. He is the Chief Operating Officer for the Virginia Department of Health here in the great Commonwealth of Virginia, United States of America. Christopher, thank you so much for being here with me today.
Susan, it's a pleasure to be here today.
Oh, I just love it so much. I met you a few months ago. Christopher came up from Richmond, Virginia, and was one of our speakers, our featured speakers at our First Responders Appreciation Breakfast. And it was just so phenomenal that day. I mean, what kind of energy did we have? It was just so good.
It was a phenomenal event. It was a really honor to be there and to see the reverence that this community gives to the first responders.
Yeah, absolutely. And through the course of listening to your remarks that day, I said to our mutual friend, Kevin Dillard, here from the Fredericksburg region and who's been on the show many a times, I said, Kevin, I want to get Christopher up here to talk to us on the Leader to Leader podcast. And I'm so glad you said yes and took time out of your busy schedule to join us today. And I'd love to dive into some things about your journey because I started there with this title, this Chief Operating Officer, Virginia Department of Health. That's a pretty big one, and he's had just an incredible career, and it expands all across different aspects of healthcare, all the way back to being a Tuckahoe Volunteer Rescue Squad and EMT basics and so on, and to go from that to the things that you're doing today, things you've done with the HCA health system and so forth. I just think you must have a phenomenal story. So I'm going to stop talking. I want to hear about it. Tell us about your leadership journey.
I thank you. Again, I appreciate the opportunity to be here today, and especially with Kevin Dillard here in the room. As many of your listeners will know, Kevin is involved in so many different areas of leadership in the Fredericksburg area, and it's I think for the first 15 times I was with him, I learned something new about something he had his fingerprints on across the Commonwealth of Virginia.
Amazing.
So, Chief Operating Officer, Virginia Department of Health, I have the opportunity of holding the inaugural COO role. There's never been a COO at the Virginia Department of Health previous to this appointment. I have the opportunity to be appointed by Governor Glenn Youngkin. I started in 2022, November of that year, in this role. VDH is by code run by a health commissioner, and Virginia code says that has to be a physician. There was never a true business leader that came into the agency prior to me, and so I had the opportunity to jump feet first in and really start to uncover opportunities to hopefully run a more efficient business of public health in Virginia.
Wow, that's super exciting. Now, tell me more about it, though, as you took on this role. Like, what does that look like? How large of scale is this?
Sure. So VDH touches every single Virginian every single day, and most times, multiple times a day. When you think about the interaction that a typical citizen may have with VDH, if you drink water out of a municipal waterworks, VDH certifies and regulates that waterworks. If you eat in a restaurant, VDH makes sure that the food served is appropriately healthy and safe. If you ever receive an immunization, if you visit a local health department for any of the myriad of services that we offer, if you have a residential drain field, if you eat oysters, we oversee the oyster business in the state of Virginia. If you are an EMS provider, our Office of EMS make sure that you are appropriately educated and have the resources at the state level to operate. If you hear of a drug overdose or a murder or a death in the Commonwealth that is non-natural, our chief medical examiner's office investigates that death. So every Virginian touches VDH every single day. We've got, counting FTEs and contractors, around 4,500 individuals in the Department of Health. Our budget is mainly federal funded, federal grants, but we've got almost $350 million of general funds and then roughly $1 billion of federal grants that we administer as well. So over $1 billion organization, almost 5,000 FTEs and contractors, and again, touch every single Virginian with a location in every single locality across the Commonwealth.
Yeah, so I mean that's significant, and to bring some business acumen in the door to really look at things from that perspective, I'm sure has been eye-opening for not just you as you were diving into it, but some of the folks around you.
I'm very proud of a lot of the accomplishments that we've made over the last 3 years. When I think about the senior leadership team, the top 7 individuals in the agency, all but 6 of those individuals are newer in the last 3 years. And we've really we've made a stated effort to hire individuals into roles that ask tough questions, that want to do things better, want to do things faster, and want to build up really administrative capacity of the work behind the scenes that enables the good public health work to happen.
I see. Now, before coming into that role, you had worked, I believe, with the HCA Virginia Health Systems, doing some of your some administrative roles there. What was that like?
Sure. So I had a very interesting journey through HCA. HCA Healthcare Corporation of America is likely the largest for-profit health system in the country. It has a presence right here in this area with the Spotsylvania facility.
Yes.
HCA, I started out, as you mentioned earlier, as an EMS provider in college. And so when I was a junior at Hampden-Sydney College, I was on the fire department. And a dear friend of mine asked me one evening to drive him to Prince Edward County Rescue Squad. He was taking an EMT course. And for some reason, he said, "Hey, why don't you walk in with me?" I think he tricked me into driving him there. Next thing I know, I was signed up for an EMT basic course.
All right.
And that started my journey in healthcare. I joined the Tuckahoe Volunteer Rescue Squad in 2009, which is a volunteer rescue squad in Henrico County, Virginia, and thought I wanted to go be a physician. I went back to school. My first degree was in economics at Hampden-Sydney. I went back and got a second degree in health sciences at VCU with the idea to go to medical school. Instead, I went to business school. Now, I didn't become a physician, but I made the wise choice to marry one. So my wife is an emergency physician at VCU.
That's awesome. I love that.
And so HCA started a role that was called Director of EMS Relations. And so I was able to take some of my business and sales background previous to that and combine it with the EMS experience. And I joined HCA Virginia in 2014, I believe, as a Director of EMS Relations for Central Virginia, which really got my foot into the door into the organization and gave me a fantastic lens into all of the Central Virginia hospitals around the way they interacted with EMS services.
So I'm going to weave a little bit more into your story from that period of time because I'm getting to know the whole you. In the year prior to that, you applied for and was accepted into the UVA Sorensen Institute for Political Leadership, which is all about civic engagement. Really unique program in the state of Virginia. I did it in 2008, and your class of 2013. Tell me about what interested you in that part of your journey.
Public service has always been something that has deeply interested me. I grew up in a home where I had a mother that when she saw something that she wanted to change, she got out there and did it. I remember
Yes.
With Sorensen, one of the questions that they ask you in your interview is, what's your first political memory?
Right. You're right. First day sitting around the horseshoe.
That's right. And I had, John Hager, the former lieutenant governor, asked me that question. And quickly what came to mind was sitting in the back of my mother's minivan. I don't know how old I was, but I was very young. And at that time, there was a long-distance call charge from where we lived in New Kent to the schools. And so anybody that lived where we did had to pay a long-distance charge to call the courthouse, to call the school system.
Wow.
And my mother thought that was wrong. And so she and another family member started petitions and went around the area in which we lived and got signatures and got that changed. And so that was my first political memory of seeing my mother see something that needed to change and taking action to do that.
Oh, my goodness. What an impact. She had no idea.
Had no idea. And my mother is somebody who, she's very impactful when she wants to be. And she volunteered in the schools my entire lifetime. In fact, she says that my first day of kindergarten was her first day in school. And it culminated in while I was a freshman in college, she ran for school board in New Kent and won 73% of the vote. And went on to have a successful 9 years as a school board member.
Okay, so 73%, but who's counting? You still remember it to this day. You counted every vote.
Very proud of that.
It's so interesting that you're saying this. Sitting right across from you is one of my favorite quotes from a mentor that impacted me in my life, which was Gordon Shelton, who was local on city council here for 24 years. And he said to me, "Nothing happens unless you make it happen." And that was on one of the first campaigns I worked on back in the day for mayor here locally. And I don't know why that resonated with me. So you saw it in action. He said it to me, and that's when it clicked of, your feet, you can go make things happen. Now, from that day that you saw that with your mom, you've been making things happen all along. And you got that bug that started with the EMS piece. So it's really been awesome to see how you've been able to kind of have this synergy of having business acumen and healthcare and pulling those things together.
One of the things that I've had the opportunity to speak through different organizations, one particularly the Virginia Volunteer Rescue Squad Association, had the opportunity to speak to their board of governors last year. And in preparing for that speech, I really thought about, and you mentioned specifically EMS, the impact that something like a volunteer EMS experience can have on a young person in Virginia. Many people go into it because they see themselves as having a career that they want to develop, whether it be a nurse or a physician assistant or so forth. But the lessons that come out of volunteer EMS can go, so much greater. You're around people that you don't typically interact with. You're going into people's homes and seeing what may look like on the outside as a very successful, wealthy, large home, and you go inside and you see something very different. You get to see people at their worst and at their best.
Yeah.
And in my mind, there's no other opportunity for a young person to experience how other people experience life than it is in volunteer EMS. And that can garner so much opportunity to go any different direction with that.
So it's really interesting, and it's just so important that the right presence. So when you show up on those days that are often worst days, or at the moment they feel like a worst day, they might not turn out to be a worst day, but they're generally some sort of a crisis moment or a moment that feels like a crisis. And how you or folks like you have navigated that, laid your hands on that, the things your wife does in emergency, it just makes the whole difference for an entire community. And so you clearly must have a leadership style, a style you've honed or grown over these years that makes you able to connect that way with people.
I appreciate you saying that. It's something that has certainly the humbling experiences of seeing action that one can take to make somebody else's life better, even if just in that one moment. It's something that you just mentioned. It's a crisis or a perceived crisis. But for someone to call 911, to pick up the phone and say, "I need your help," it's a crisis. Whether it is or it isn't, it's a crisis to them. And so being able to intervene and make their life a bit better, even in that moment, is certainly impactful.
Sure. And then to be working as you have been in more recent years on the business side of seeing efficiencies and ways to support all of those operations, whether it's EMS or other things to do with healthcare. That's a special calling too. What really draws you to all of that on the business side?
I remember I was doing my master's in business administration, my MBA at VCU, and I was on the latter half of that first experience at HCA. And I remember standing in the ER at Chippenham Hospital in Southside Richmond. And I remember watching a patient come through the door on an EMS stretcher, and then watching the process of how they went through their continuum of care. And for the first time, I remember thinking that's the value of that MBA, because it made me think about a process differently. How do you break this step, this system of steps down into individual pieces, and how do we make each of them more efficient? How do we get that patient moved quicker through the system with the appropriate care where it's needed? And that was the first time that really the light bulb went off of, we can look at a process, we can make it better by breaking it down into individual pieces and making the problem seem even easier to solve by making it smaller.
So you really do, you seek problems or issues and find the solutions.
I've been blessed to work with a lot of people that have that same mindset. I would say in this role right now, at VDH, has been, over the last 3 years, we've uncovered a lot of opportunity.
Yeah.
And as I mentioned, we've been very fortunate to hire a lot of leadership in that sees it the same way. And I'm sure we'll get into more of that experience, but it has been an amazing experience at the Virginia Department of Health over the last 3 years, and really looking at processes. How do we make them more efficient? How do we be more efficient from a government spending standpoint? How do we hire the right people? How do we increase the speed of business in state government? That's something I'm very proud of.
Ooh, yeah. And you have to in Virginia, and every 4 years it changes.
That's right. Every 4 years it changes. We're the only state in the country where governors cannot run for continuous terms. And with the change in governor, of course, there many times comes change of course, cabinet members, but also agency heads. And so every 4 years you see a lot of leadership change in Virginia. And so it's definitely can be an opportunity to bring in new ideas, but sometimes it also stalls good ideas that have good momentum.
Sure. Yeah. Whenever there's that change, it can set things back or somehow propel it forward. And I love that your whole career has been your time. You're a Virginian through and through.
That's right.
And we don't always see that. It's certainly our state and different parts of the state, the Commonwealth, have had a lot of growth. We're sitting in one of the fastest growing regions in the Commonwealth right here, where our friend Kevin Dillard and I often find ourselves the only ones in the room anymore that are from here. So anyhow, clearly you've got a heart for Virginia. In this role that you've had these last 3 years, I bet you had to travel a lot around the state. What are the things that you've seen that have been new to you and impactful to you as you've visited around the state and learned more about specific needs that you may not have otherwise?
The diversity of environments in Virginia is great.
Mm-hmm.
I've had the opportunity to be in Lee County, which is the furthest southwestern tip of Virginia. I've had the opportunity to travel all over northern Virginia,
Right.
Up the eastern shore and across Southside Virginia. And the environments of Virginia are very, very different. The disparities in wealth and opportunity and access to healthcare and access to jobs is substantial. And I think your point, I've had the opportunity to experience many of these communities, many through the work that we've done through the Office of EMS. I've had the opportunity to travel and meet with a lot of rescue squads and fire and EMS agencies across the state and really look at how do we as a central office of the Virginia Department of Health make sure that there's a appropriate opportunity for resources for those providers and ultimately those patients.
Excellent. So as you're processing all of this and you're looking at things and looking for efficiencies and how can I do this quick enough? Let's talk about how you show up with that leadership style and how you would describe it. What would people say that work around you? Like, we can tell when he's really thinking hard or, charging up the hill or stressed or not stressed. All of us have a different style. And has that changed or morphed over time?
I think it probably has.
Mm-hmm.
It's definitely been a journey in this role. One of the things that has really impressed me about this opportunity is to work for a governor like Glenn Youngkin.
Mm-hmm.
Glenn Youngkin is not only a terrific governor, but he had a phenomenal history prior to that in his work in the private sector. It was in July of 2022. Let's see, I was out actually took a couple of weeks out when my son was born. And I came back on one meeting that he had. He brought all the agency heads together and he was discussing different management styles in state government. And I remember there was a slide that said senior leadership involved in the details of the business. And that really resonated with me. Senior leadership needs to not only understand the business, but also ask the questions of how do we do this differently? How do we do this better? And that's something that stuck with me in this experience. And so I think what people would say is that Christopher asks a lot of questions. He dives in deep. He, I think, asks tough questions. And because of the nature of this role, I knew that there was a finite period that I had in which to get something done. And so I believe the pace at which I have moved and pushed our organization to move is likely faster than organizations might have existed previously in state government. I'm very proud of the speed at which we've made things happen.
What do you do to slow down? That must be when you're not working. How do you relax? Tell me about it. Do you relax? Come on.
Of course. One of the passionate projects that we have, actually my family has, we own it's called the Lindsay Arboretum and Game Preserve in New Kent County.
Okay.
We own a farm on the Chickahominy Lake in Providence Forge. We've planted over 37,000 trees in the last 5 or 6 years. My father's done a majority of the work there. It's really been a passion project of his. We took a farm and we bought the farm beside it, and we have created it into a game preserve for deer management. So we do a lot of hunting, a lot of planting trees, a lot of work, a lot of cutting grass. We spend a lot of time there as a family, and that's something that I'm excited to have my son, who's again 2.5, have him start to come in the fold there. So it's really an opportunity for all the family to work together and have a really fun project.
It's a nice balance. You're in Richmond, Virginia. You're in the heart of everything. The cars are whizzing by, the skyscrapers, all of it. And then you're outside with nature. and so you've got that balancing piece. When you think about the folks in your life, I like to think of people as, that have really influenced you. You mentioned your mom earlier, but has there been like somebody that's had a tremendous impact, like a mentor that you think has shaped some of this journey for you? Or more than one? There could be many, but
Oh, that's a great question.
Yeah.
And many times when you think about leadership, at least in my mind, comes to thought instances where you saw a leader do something that you thought I would do that differently.
Yeah.
And, we've all had those leaders. We've had leaders where we think about, really appreciate the support. I think back on one particular leader that showed very supportive. How can I help you be more successful? And then I've had leaders also that you maybe hired me and put me into a leadership position, and then we're less hands-on. And when you see somebody make a mistake, maybe not correct them as quick or as appropriately as it should be. And I've certainly had those opportunities. I think back on some of the experiences I had early in hospital administration, coming in young with a title, and all of a sudden I've got people working for me, and, I've got this degree and I know how to do things better. Well, nurses that have been at the bedside for 20 plus years, they know how to do things better. And so, I think back on some specific instances where I did or said things that very quickly got me off course. And because of those experiences, one particular leader gave me the grace of correcting that behavior, and that put me on a different trajectory. So if I hadn't have made that mistake, I don't know where I would have gone, obviously. But,
or if they hadn't pointed it out to you in a way that you could process and hear.
Right.
So it's sometimes it's the method of that communication.
That's right.
Yeah.
And I do want to point out there was, thinking through impactful folks. There was one of your board members, actually, Ryan DeWeese, the CEO at the Spotsylvania Hospital. I remember when I was applying for my first administrative position at HCA, he was already in a role similar to that. And I was talking to him about the interview process, and he said, Christopher, just remember that your job as an administrator is to be the support. The important work is happening by the clinical providers interacting with the patient. Your job as a leader is to give them the tools and the resources to do their job, and then really get out of the way other than to remove barriers. And that's something that's always stuck with me. Give them the tools and the resources to do their job, hire the right people, and remove barriers. And I've taken that a step further in this role and others. And really, after you do that, don't just step aside, but really be a cheerleader. Make sure that you're touting the good work publicly. And I've had the opportunity and the blessing really in this role. It's been a very public role. I've had a lot of opportunity for media involvement. I've had a lot of opportunity to interact with senior leaders of government, whether it be cabinet officials or even the governor himself. And I really want to celebrate the wins of the team members that I have when they do good work. And that, at least for me, when somebody celebrates something good that I've done, it makes me want to do more. And I've seen that as well. And so I really do think make sure they've got the resources to do their job, step out of the way, and then celebrate their wins. Occasionally, you have to hold folks accountable.
Yep.
And having those tough questions and tough conversations can ultimately lead to better outcomes.
Mm-hmm. Tell me about some of your wins that you've celebrated. I bet you some are big, but plenty are smaller too, but impactful.
I think speaking about this specific journey at VDH, when we came into this, the health commissioner and myself, Dr. Karen Shelton, we've both been there right about the same time period. The administrative functions behind the scenes at VDH had been somewhat neglected for many years. And a lot of that was due to the recent COVID experience. There was a massive influx, over $2 billion of federal dollars come into the agency. And there was really little, if any, appropriation towards standing up what would be called the administrative function. And that means the financial management offices, the grant management side of things, the human resources, the information management, the procurement. These are all the important things behind the scenes that enable the public health work to happen compliantly, efficiently, and appropriately spending amounts. And so we've really dedicated an incredible amount of resources to building up those functions. The administrative function with human resources, we've taken that from almost a 40% vacancy rate down to 0% vacancy rate. We created an Office of Grants Administration, so we've got true professionals now that are trained and dedicated to appropriately managing federal grants. We've taken the Office of Financial Management, which was around a 60% vacancy rate, and that's down very close to very few vacancies with the right leaders involved in that. We created a Chief Financial Officer position and have a gentleman who's doing a fantastic job in running that office. We've got a new procurement director who's really doing a fantastic job. Um, One of the wins has been with the Office of EMS. And so, about in the first year, we put in some new budget uh, meetings that really asked some tough questions around how our office is managing their budget. And one tough question led to several others. And all of a sudden, we had $33 million of misappropriation. Over $4 million of that was fraudulently spent by a former leader. And so, that led to bigger conversations of how do we rebuild that office. And so now we've got new leadership in Office of EMS. We've got new processes that are really changing the way that EMS services are run across the state. Something I'm involved in very closely right now is our Office of Licensure and Certification. OLC oversees the regulatory side of every hospital in Virginia, every nursing home, every hospice provider, and every home care provider. Back in the summer, we were at a point where we could really start to turn attention towards rebuilding OLC, which had over a 40% vacancy rate across the office. The particular pain point was in the way we interacted with nursing homes across Virginia. We have the responsibility of being the administrator for CMS as far as surveying, not only complaints, but also proactive surveys, and VDH is way behind in that. So we've made a concerted effort to hire the right leaders, to hire the right amount of inspectors, and we've hired, as of 2 days ago, we've hired 40 people in the last 5 months in that office. We've hired the right clinical leaders that are making an impact already. We've had some process changes. We've brought in new technologies for citizens across Virginia to interact with that office, to register complaints. And I think a year from now, we're going to see a faster movement towards higher quality care in nursing homes specifically because of the work that our office is doing now.
You know, that's just not something you hear about every day, and we should. At the rate that Americans are living longer and people are finding the needs for long-term elder care nursing homes, and it's such a tough environment. And to just know there's people like you and the folks you work with, the people around you, working so hard to make that better, it's just comforting because it's necessary. And knowing that you're out there asking the questions and looking at this can be better.
Well, it's one thing that we've said many times, and I'll say it again. It is up to the leaders in nursing homes to provide high quality care.
Yes.
But it's up to the Virginia Department of Health to hold them accountable.
Right.
And we need to have the right teams with the right amount of folks in the field to hold them accountable. And that's something that we're working towards.
Well, thank you for that. Love hearing that. That's terrific. That's a lot of wins. I wasn't quite sure you were going to say a win was, Susie, you made it into the office 5 days in a row on time. See, a little humor here. But so many big things, leaps and bounds that are just making such a significant difference. It's just, wow. So I'm sure you're going to look back at this experience and think, what a rewarding time in my life. Did you ever see yourself doing exactly this or anything close to it when you were starting out?
No, I certainly didn't. It's been really a rewarding experience. It's something that's given me a lot of personal reward in the work we're doing. But, to your point about the last several years, it's been a wild 3 years. I was, let's see, in 3.5 years ago, I got married. 2.5 years ago, my son was born. 3 years ago, I had the opportunity to start this job. So it's been a lot of personal and professional growth for the last 3 years.
Yeah, that's quite a lot. And congratulations on all of that.
Thank you.
As you go about your day, you see people, you'll come in contact with someone that reminds you of where you were at different parts of your journey. What kind of advice would you give somebody you can see starting on some of these pathways that you've taken?
I think take a risk. The way that I came into this job is I knew I wanted a role similar to this. I didn't know what that was. And I found the right person and asked the question and said, this is something I'd like to do. Where's the opportunity? So don't be scared to go outside of your comfort zone. If you see something you want, ask for it. The worst somebody can say is no.
That's
and
right.
then and you move on to something else. But if you see something you want, ask for it. Don't be afraid to raise your hand and say, I'd like to take that opportunity, because chances are you're going to get it.
Seek the opportunity. I remember hearing that years ago in a leadership Fredericksburg class from now Congressman Rob Whitman, and he talked about those moments of opportunity. And he said, you have a decision to make. You take it or you don't. You seize it or you don't. You go after it or you don't. So you've had a whole life experience of finding those opportunities, and what a blessing to be able to put your passions together, to find ways to do the things that you love so much. It really shows.
Well, thank you.
Yeah, and we thank you. Well, as we begin to wind down our time together, it goes by so fast. I could talk to you all day. I just want to kind of start to close out and ask you about if you have a favorite motto or saying that you maybe have up on your wall or you think about a lot.
There's a quote that comes to mind. I had a dear friend in college. His name was Simon Everett, and Simon's the one that actually tricked me into driving him to the rescue squad.
The trickery.
The trickery, yes. He had a lot of trickery. Simon was a dear friend. He was on the fire department with me. He tricked me into taking an EMT course, and that really set a trajectory on my life. And he had something that he always would end a conversation with: "What can I do for you?" And it was usually, "Hey, what can I do for you?" You know, it was very friendly, but he meant it. And if I always knew that if I needed, somebody to pull me out of a ditch or to come, help me with a life-changing goal, he would be there to help me with that. We were 30 years old. Simon died in a very tragic accident.
Oh, my goodness.
And that was a very, very impactful time in my life. Mm-hmm. Really, that is very impactful. Simon was a dear friend. Still very close with his parents. Comes from a fantastic family, but that's somebody who I look back on, who I didn't know it at the time, but the impact that he had on me certainly had impact on the trajectory of my life. And that quote, he used to end every single conversation: "What can I do for you?" And that's something that can take you very far in life, by asking somebody, "What can I do for you?" And that's ultimately going to lead to some pretty terrific outcomes.
Well, thank you for honoring him today and keeping his memory. When people have that impact on your life, that leave the footprints on your heart, it's important to stay close to those thoughts. And I appreciate you sharing it with us. Yeah. Is there anything else you'd like to share with our listeners?
No, I just really appreciate the opportunity to be here. Again, opportunity to serve in this capacity over the last 3 years and several months. And not quite sure what the next step looks like, other than I'm going duck hunting in January.
Yeah.
And I'm pretty excited about it.
Oh, that sounds pretty good, I suppose. But like I said, those poor little ducks, stay out of his way. Just watch out. Here he comes. Here he comes. No, it's great. And thank you for all that you do. And I can't wait to see next phases of your journey and have you back and say, let's talk about where we are today, maybe every few years or so. And it's just going to be great to watch as you continue. And maybe we'll do another show and talk about Sorensen the whole time.
Sounds like a good one.
Because that's a whole other great topic too. Well, anyway, thank you again for being with us. Our guest today was Christopher Lindsay, Chief Operating Officer for the Virginia Department of Health here in the Commonwealth, the great Commonwealth of Virginia in the blessed United States of America. You are listening to the Fredericksburg Regional Chamber of Commerce Leader to Leader podcast. I'm your host, Susan Spears, and we thank you for being with us today. Make sure you go ahead and like this podcast so you can hear about more of the great leaders that we have in our area. And thank you. See you next time.